Hello, everyone. My name is Debbie Fox, and I'm with the National Network to End Domestic Violence, and I'm a part of the Deviant Housing Technical Assistance Consortium with Collaborative Solutions, the National Alliance for Safe Housing, and the National Resource Center on Domestic Violence. I'm very pleased to welcome you to our Coordinated Entry, Supporting DV Survivors, and Innovative Emergency Best Practices webinar series today on March 15th, 2018. On today's webinar, you'll be hearing from Kelly Anelli and Karen Jarmuck from the Connecticut Coalition Against Domestic Violence, and Brian Rockapori from the Connecticut Coalition to End Homelessness about their coordinated entry planning and implementation process in their state. Also joining us on the call during the Q&A portion of the webinar is Fran Ledger from the Special Needs Assistance Program Office at HUD. HUD is joining us on the call as a representative and to answer any HUD-related questions during the Q&A. Their participation is not an official endorsement of the specific coordinated entry process, but to be a resource if HUD-specific questions arise. The goal of the Deviant Housing Technical Assistance Consortium Coordinated Entry Series is to highlight what bubbles up from the field and what we are hearing works to share with you all. There is no one right way to roll out coordinated entry, and we encourage you to take the ideas shared here today to inspire you and to keep you moving forward with creating or improving the survivor-centered procedures in your community. So without further ado, I'll turn it over to Karen Jarmuck to begin our coordinated entry webinar. Go for it, Karen.
Thanks so much, Debbie, and thank you everyone for participating in this webinar. We appreciate being asked to talk about the work that we've been doing in Connecticut, and I think, Debbie, you made some really good points around the fact that there's probably multiple strategies that are being undertaken in various states to ensure that victims or just domestic violence survivors have access to housing resources. So we just appreciate the chance to talk through with you all on this webinar around the work that we've been doing in Connecticut, knowing that all states look different and there might be different approaches. But this is something we've worked really hard on. It's been more than 5 years that we've been working on this very collaboratively together. And so we appreciate the occasion to be able to talk about it, and obviously very happy to answer any questions. And I'm really, really happy that this isn't one of those webinars where you can all see me, and I have to be worried about that. So I'm thrilled to just be able to talk through this. So if you look on the second slide of the agenda, we thought that we would do a couple of things on this webinar today. One is knowing that things look differently in all states, we just wanted to be able to give you all some context around what it looks like in Connecticut, because this may or may not, how we're doing things may or may not work in your particular state, but I think we all feel fairly confident that there are absolutely a bunch of strategies and or tools that we've been able to test and develop that certainly could apply in your state or for your region. And so we're just going to outline what the landscape looks like. And in that regard, we're going to take a look at what coordinated entry looks like in our state, just to give you some understanding of how we were able to utilize the current structure and then try to make things work. We also wanted to talk about the collaboration, which is a really key element of all of this work, because there are some really strong components around policy and practice and training and leadership that I'm going to speak about later on in this webinar that have been incredibly critical to how we've been able to make this work. And so we're also acknowledging that this is always a work in progress, and we continuously are revisiting this approach and fine-tuning this approach to ensure that we're doing the best job that we can for domestic violence survivors around housing, as well as for individuals in our state who are housing insecure. And then some other folks from CCADV and CCEH, Connecticut Coalition to End Homelessness, are going to talk about just this model that we've developed and how we developed it, and then lessons learned, because we're absolutely still learning, But we do feel like over the past 5+ years, we have really learned some valuable things about how we work together. And the nice thing also is that we're having some really great results for domestic violence survivors around housing. And then, of course, we're very happy to answer any questions in this webinar or answer any questions moving forward. If you wanted to contact us offline, that's later on, that's absolutely fine as well. So in terms of coordinated entry, what we thought would be important for everyone to be able to see is what things look like. Connecticut, relative to many of your states, is a fairly small state. The Connecticut Coalition Against Domestic Violence is a member organization, so the 18 designated domestic violence providers in the state of Connecticut are actually all members of CCADV. And that's important for a couple of reasons in terms of how we were able to create this structure and this protocol around housing, because within the 18 providers, and so each region, as you can see, is in a different color to give you some context around what it looks like. But within each of those regions, CCADV actually is a pass-through funder, so we have a $13.3 million budget. We pass through about $13 million of that through state and federal dollars to, like many of you who are domestic violence providers, offer those critical services out to the field around hotline and shelter, legal advocacy, counseling, and all of those things that we do to keep survivors safe. But what has been an important piece to all this and why it's been so effectual is that in order to be a member of CCADV and receive a contract for services, everyone has to meet what we call standards. So we work very collectively with the domestic violence providers in the state to develop standards. And so part of this work around coordinated access and participation in coordinated access and housing access is a requirement. So I know that for some providers that may or may not be an option, but we just wanted to point that out because that has actually really allowed for a lot of consistency. It's allowed us to create policy and to really formulate our training around that. So I just wanted to make note of that point. Brian, on the next two slides, I just thought if you wouldn't mind just talking about what it looks like from the housing side in Connecticut.
Yeah, absolutely. Just making sure you can hear me on your end.
I can hear you.
Okay, fantastic. That means everybody else can hear me too. Okay, so my name is Brian Roccapriori. My full job title is the Director of the Homeless Management Information System and Strategic Analysis at the Connecticut Coalition to End Homelessness. That's just a fancy way of saying that I'm the data guy here in the state. And what we're looking at on the screen now is what the continuums of care look like in Connecticut. And for those unfamiliar with that, that is HUD service delivery areas. So when the money comes in from HUD, they go to these two different regions that you see on the map. Now, it didn't always look like this in Connecticut. Over the past 10 years, we have merged multiple continuums of care down into the two you see today. At one point, we actually had 13 of them, which is more than the number that Texas currently has. So for a state the size of Connecticut, that was just a little ridiculous, and there's a lot of efficiencies that can be had with smaller COCs in a smaller state like Connecticut. And while we are a small state, we're still 110 miles across. So from a service delivery perspective, having a coordinated entry system across the entire COC is kind of a big lift. So what we decided to do was take a look at our HMIS data to see where folks were going to and from, because we do have one statewide HMIS that is multi-COC. It was that way back when there were 9 COCs, and luckily we merged down to the 2 today. So looking at all of that information, what we did was we came up with our coordinated access networks, which is up on your screen right now. You'll probably hear us, either Karen or myself, call them CANs at some point. Those are our coordinated access networks. I do my best to not speak in acronyms because I know not everybody understands what's going on in my head all the time. So what happens here is if you are finding yourself in a housing crisis situation, this is going to kind of determine where you are going to get services or where you want to get services, because it's all client choice. And it doesn't have to be one specific one. If you wanted to receive housing in the northwestern part of the state and you're currently in the southeastern part of the state, good on you. We'll work with you there. Or if it doesn't matter to you, that's also okay. And how that works in Connecticut is we use our 211 info line as our universal front door to the system. So what happens is if anybody finds themselves in a housing crisis, what they do is they'll call 211, or if they find themselves at a project, they can have the project go in and call for them. And 211 has a specialized unit to handle housing crisis calls. And what they do there is they'll provide a high level of diversion. And by that, I mean they can help screen folks out who might not be appropriate for housing services. Somebody who's calling to be on like a Section 8 wait list, or if somebody is calling because their lights got turned off and what they really need is some energy assistance and not access to an emergency shelter, they're able to provide that level of diversion. And if they happen to find out that someone is currently in a domestic violence situation, they can route that person immediately into the domestic violence world, and we wouldn't have any sight over what that person is in our system. But if that person can't be diverted to 211, all of those housing specialists are licensed 211 users, not licensed HMIS users, excuse me. So they'll go in and create that client record in HMIS and then make the referral into one of the coordinated access networks, where then the providers in that region will kind of pick up the ball and get that individual to the services that are best appropriate for them. And what makes our system pretty powerful is that we have a lot of different participating entities. We have our State Department of Housing, our State Department of Mental Health. We have a number of hospitals and mental health authorities, outreach projects. We have soup kitchens, employment projects. It runs all over the place. There's almost no wrong door to get into our system, but all doors lead through 211. So once that happens, they go in and then they start the flow of the process in the mainstream housing services. And in a little while, we're going to get to how those who are in the domestic violence projects can access our mainstream housing services. But first, we will kick it back over to Karen to talk about what our DV system provides.
So a couple things, and Brian, thank you for talking about coordinated entry, especially through 211. Just so folks who are listening know that there are a number of circumstances where domestic violence survivors do call 211, and if they indicate that they are experiencing domestic violence, that 211 operator immediately diverts them to one of the domestic violence providers or Connecticut statewide hotline or Spanish hotline. So that's how people are being diverted when that challenge comes up. They are diverted to our system. And I won't go into great detail around what the DV system provides in Connecticut, because my sense is that it's very similar to what is being provided in multiple other states. But I will say a few things. So we have challenges like everyone else does, and in particular, shelters in the state of Connecticut. So there are 18 domestic violence providers, 15 of which have shelters. And hang on, I'm just getting a little funny thing on my screen. 15 out of the 18 have actual physical bed shelters. And the other remaining do hotel motel stays. But what's important to make note of is that all of our the safety through housing in the domestic violence system is at 122% capacity all the time. And so, like for many of you, what we're experiencing in Connecticut is a shortage of shelter beds, and that is for a couple of reasons that we view. One is that when survivors are coming into the shelter system for help, domestic violence shelter system, it's very complex. Their challenges are multi-layered. It is taking much longer to try to get individuals and families to their next best place. In Connecticut in particular, there have been significant budget cuts on the state side, and therefore the safety net, not just within our system, but within other systems, is collapsing a bit. And so those resources that used to exist previously no longer exist or look differently. And so what we're seeing is that, A, people are staying longer in domestic violence shelters, and B, they're also staying longer because the housing resources are not always available. And that's not a criticism of the housing system. It's just resources, like for so many of us. So the resources are what they are. They're often scarce, and so that's why the work that we've been doing with the Connecticut Coalition to End Homelessness is so important, because we're really prioritizing the needs of domestic violence survivors and also the needs of housing insecure individuals, and how do we ensure that there's equal access and opportunities for everyone. And so what I would also want to make note of, so that you know, is that in Connecticut, some 5 out of the 18 domestic violence providers actually offer some form of either transitional housing through on-site or scattered site, and then we have a few that are providing permanent supportive housing. And so in total, the number of beds that are available for those purposes are 171 beds, or 74 units across the state. And those are very specific outside of what we're doing with the Connecticut Coalition to End Homelessness and through our coordinated access. Those are housing resources that we juggle within our own system. Brian?
So I was just going to say, much like what Karen was just saying, I'm imagining that the resources available in the mainstream system are probably similar to what a lot of you have in your systems as well. Through both of our COCs, I think it's like a $45 million investment in homeless services. And we are very lucky in the state of Connecticut to have some great partners in both our Department of Housing and our Department of Mental Health and Addiction Services. And they provide more funding than the federal government does, because they really see that making that investment is worthwhile in Connecticut. And it's great to have them not only as a funder, but as a partner to help guide this process through, because the collaboration between the Connecticut Coalition and Homelessness and the Connecticut Coalition Against Domestic Violence has been successful because of the partnership with all of our state organizations. And what we provide for mainstream resources is exactly what you see up on your screen. It's the shelter diversion services to help folks from entering shelter in the first place. We have a couple different funds that we administer in the state to help that process. Our emergency shelter, and then our temporary housing with transitional, and our permanent housing solutions with rapid rehousing and permanent supportive housing.
So I'm seeing a question here from Shelley March, and the question is, I'm wondering if your 211 responders are trained in domestic violence and how the cases are handled where a caller might not identify right away as a domestic violence survivor halfway through the process, and how that then gets diverted to a DV program. And so without being entered into HMIS. So the answer, I have 2 answers, and Brian, I might ask you for your help on the second, but I think I know the answer. So 211 responders are trained by certified domestic violence trainers through the Connecticut Coalition Against Domestic Violence, and so they do receive training on domestic violence. We work very collaboratively with 211. And then the other piece is, my understanding is that it can be, the system can be swiped if they are inadvertently put into HMIS. But my understanding is that what I can say is that we're not viewing that there is a problem where the domestic violence is not showing itself sooner than later, and the person is being inadvertently put into HMIS. Is that your understanding, Brian?
That's correct.
Okay. All right, so we're going to move on, and Sherry, if I didn't answer your question well enough, you're always welcome to contact me directly. And so, Brian, I don't know if you want to talk this through, I'm happy to, but we just thought we would include some language that's offered through HUD around coordinated access and how that works. So just to reiterate, there are coordinated access regions within every single region in the state of Connecticut. And so it is within contracts that domestic violence providers have to be active participants in their region, in their coordinated access region. And that does present some challenges for advocates, and we hear about that. And Kelly, I don't know if you want to chime in here as well, but basically, as for many of you also, advocates are pulled in multiple directions, and participating regularly, sometimes it's weekly, sometimes it's every other week in a coordinated access meeting, given time and resources, can be really hard. And then if you look at, I'll just go back for one moment. If you look at on the screen, here's the coordinated access regional map, and then if you look at the domestic violence map and what that looks like, you can tell that for some domestic violence providers, they have to be active participants in one or two or sometimes three CANs, and that can be really hard. So I don't know if I'm making sense to people, but just because you're down here, it doesn't mean that you might have to be actively engaged in two CANs because your region actually cuts across two CANs. And so that's really difficult for advocates in terms of their time and resources, but it's actually a very important piece to how this can be successful, because as we know, if you're not at the table, then it makes it much more difficult to be able to advocate at these meetings for housing and or to answer any questions when we're trying to get housing for domestic violence survivors. So Brian, I don't know if you want to speak to the pieces here around the HUD language. I know that you folks wanted to include it, and it basically speaks to how we're moving forward in Connecticut around creating a fair and equitable path to homeless response resources for both of our systems.
Mm-hmm. So when coordinated entry first became a thing, there were no real examples for us to pull from, and the analogy I always like to use is that we were building the airplane while we were flying it. So we used the HUD coordinated entry brief as kind of a guide as we went along, and on its face it seems real simple, just that resources should be available to everybody who needs them. But in reality, we know it's not that simple, which is why we're all in a webinar together today. So part of our challenge was creating that equitable path for people accessing services in both of our systems. And before this, we were kind of two very siloed systems. And speaking from the mainstream provider side, even there were silos inside of our silos inside of our silos, but our coordinated entry system helped break that down and make it fair not just for the people in both of our systems, but for the people in just the mainstream system, period. It was somewhat chaotic before that, just waitlist on top of waitlist, and it's really streamlined and helped us provide services better in a more targeted fashion to those who actually need them. There was a question in the box of who funds 211, and that comes through two different places right now. One, there are coordinated entry funds that come in through our HUD grants, and the majority of our 211 is funded through our State Department of Housing. So moving on. What we did when we built our mainstream services, what we built it off of was the emerging best practices that were going on, which included using a prioritized list that was built entirely inside of our HMIS. And what we're going to talk about in a little bit is how we were able to include those who were served in our domestic violence system as well. And there's a lot to that, so we're going to get there. And of course, we have rules in our system too. We have limitations on who we can serve and who is eligible for services, and all that comes from HUD and their guidance. Karen, did you want to talk about or Kelly, maybe the specific urgency in DV cases and how we track that?
Yeah, sure. Thank you. Thank you, everyone, for being on the webinar today. I'm Kelly Anelli. I'm the Director of Member Organization Services at the Connecticut Coalition Against Domestic Violence. And what we found was there was an urgency which is pretty universal across the country, of DV cases and getting into housing. There's different tools that are utilized, and we'll get to that a little bit further down to discuss and determine high-risk factors. But what's happening is we had individuals that weren't able to access the system knowing that they needed housing, they needed safe and accessible housing resources. So what we were able to do was, in-house, we were able to determine the urgency for someone to have to get into housing. And then what you'll see on our referral page is it has a high-risk priority where the coordinated access networks can then, once it's moved into the CAN, can then assist them becoming a priority on the CAN list.
And so we'll get into more around the specifics of that, and thank you, Kelly. And so why don't I start again with how we develop this collaboration, because the way that we determine risk is a part of that whole process. And so we felt it was really important to give some context around how we came to this place, because this has been more than 5 years that we've been working together. And so leadership is clearly a key element of this. And so in that regard, what we mean by leadership is I, as the head of the Connecticut Coalition Against Domestic Violence, Brian's colleague, Lisa Tepper-Bates, who couldn't be with us today, but she leads the Connecticut Coalition to End Homelessness, and then also the Connecticut Department of Housing. So we are all vested in making this work. We decided to be very collaborative together. It has meant over time that we have had to ebb and flow and have some really difficult conversations sometimes around the specific needs of the populations that we're serving. But the leadership has been truly essential, especially as we've been working hard to roll this out within our different systems, because and it has occurred where when that pushback occurs, we always have to be on the same page as well and be willing to work together and continue to troubleshoot and to think through challenges. So I'm just going to, the check-in with national partners, I'm going to put that down a little bit below, because what I wanted to speak to is the identification of shared principles, the establishment of policy and protocols. So, and we're happy to share this with anyone who's interested, but what we did initially as we set about creating this collaboration was determine and land upon an agreed set of guiding principles for integrating domestic violence services into Connecticut's coordinated access system. And so that is very much vested in collaboration amongst providers. It honors client choice, and I think Brian spoke about this earlier around geography and services that they need, because we know that often a domestic violence survivor, while they might be in one area of the state, it might be either safer or speak to their needs in terms of getting to their next best place, better for them to be elsewhere in the state. And so we developed, it's a whole set of principles. We're very happy to share it with you, but that's sort of our guiding document in terms of how we work together. We've all agreed to adhere to these principles in terms of how we work together. And then that led us to how we create an effective coordinated access system in the state of Connecticut, and that's very much vested in, again, how we work with the 211 call specialists, how we work with them around training specific to the unique needs of domestic violence survivors. It also has meant that we do extensive training within both of our systems. So sometimes training occurs separately. Sometimes there's cross-training. There are roundtables and other gatherings that we convene in order to ensure that all of our systems are working. And what's also important to make note of when we're talking about training and collaboration is that within each of the regional coordinated access teams, some work really well. Some have been working well for years. Some of them don't work so well. And so that as leaders within this whole collaboration, there has been a need for us to troubleshoot insert ourselves into the work that's happening in communities, to be able to facilitate a really strong collaboration for the best interests of both of the constituencies that we're seeking to help. And so in terms of the collaboration that we're going to speak to and the protocol that we've developed, I wanted to make note of the fact that as we went along in trying to figure this out, we were sure to check in with our national partners, some of whom are on the phone today. So we checked in with the National Network, the National Resource Center, and the Confidentiality Institute. And what I will say is that we're a work in progress. We are trying to, in the best way that we possibly can, while adhering to federal regulations and our contracts, ensure that we're meeting those guidelines. But we also felt that without any concrete guidance on the federal side, we needed to move forward for the sake of the domestic violence survivors whom we're trying to ensure access to housing for. So we wanted to be sure that we were checking in with national partners, that we were working collectively together, that we were being transparent, that we were communicating well. You know, when I gave you an example of there have been questions along the way, and sometimes you'll have one constituency try to push against the other. And so we've actually done joint communications together, out together to to the DV advocates and also to the housing caseworkers, so that they're hearing from our end that this is a very unified approach that we're taking, that we're communicating and working well together. And so that has been hugely important as well. And then there's ongoing technical assistance and support. That's hugely important because there are always going to be questions. There are always going to be things that we hadn't thought of that we need to deal with. And so the domestic violence advocates and housing advocates know that they can reach out to either of our agencies to get some guidance and support and help. And so, Kelly, do you want to start talking through how the system works? What I want to be clear on is a couple of things because I know that there's going to be some discussion around this. So there is no domestic violence provider or CCADV that is entering into HMIS. So I just want to be really clear on that. There is no doing that. And Kelly's going to get to the piece around the Connecticut Coalition to End Homelessness and what they're entering in a non-identified way. And that was obviously developed with a lot of work and with check-ins around national partners. And so, Kelly, why don't you start in terms of how we move forward with this?
Okay, thank you, Karen. So here at CCADV and at our 18-member organizations, we receive training for administering the VI SPDAT tool. Very long name. It's Vulnerability Index. Brian, can you help me out with the SPDAT portion of it?
Vulnerability Index Service Prioritization Decision Assistance Tool.
So VI SPDAT to make it easier. But what happens is these VI SPDATs are usually administered at a coordinated access appointment. And most of the time it's when somebody is 48 hours out. So maybe they're being evicted, they could be leaving their home, or they're going to be homeless. So, and at times the wait is for a CAN appointment is lengthier than some of our clients have. So we were trained by CCEH to administer in-house the VI SPDAT tool. There's a VI SPDAT tool for an individual, and there's also one with a family for families. Families have a couple extra questions. From there, an individual or a family is given a VI SPDAT score. Now, usually what happens at a CAN meeting is from there they're entered into the HMIS system. The issue with that for our clients is confidentiality, is where when someone is entered into the HMIS system, there is identifying criteria and factors that are given of an individual, which can put our clients at risk. So in-house, our housing advocates or our domestic violence advocates are doing the VI SPDAT. We have developed, and I believe it's on a page, on the next page, which everyone will be able to see, is we've developed a form. Each of the 18 domestic violence programs has a data entry code. So I will code it on my end once the form comes through. They'll enter on their end what can the client is seeking housing placement in. Which is nice about that is being that we're at such a high utilization rate, when someone calls maybe from the northern part of the state, there's only room in the southern part of the state. But that individual's resources, possibly family, their cultural links and needs may still be in where they originated from. So this opens the door for our clients to select where they'd like to live throughout the state, not necessarily in the catchment that they're in any given shelter. And next,
Kelly,
we'll
can
enter the score.
Can I just interject for one moment?
Yes.
In terms of how we develop this process, I just want to point to some of the areas where we really worked hard around the confidentiality piece. And so one of which is, you'll notice on this slide under CCADV provides further de-identified set of information. So originally when we were looking to how do we de-identify but offer some information to the CAN around the housing needs of this particular domestic violence survivor, this says housing type required, number of rooms. So originally we had that perhaps it's an adult plus 2 or an adult plus 3. That was part of our de-identifying process, was to just say 1 room, 2 rooms, 3 rooms, whatever that might be, as an additional way, an additional layer of offering confidentiality. And so I just wanted to, think through an example of when we were using this process, how we came to that.
Great. Thank you, Karen.
And Kelly, tell me if you want me to move to the next.
The next question is chronically homeless. So the individual is here in Connecticut, you have to be document ready to be chronically homeless. So has the person met the criteria of being chronically homeless? After that, what we spoke about earlier about the high-risk priority, that's not necessarily just the lethality assessment, but we have the SSRI in our court systems. We have the Connecticut does the lethality assessment program. That is statewide, so every municipality, college, tribal unit, and also state police are utilizing the LAP. So the LAP is taken into account when we're asking if the person's high-risk priority. And also we have a lethality, a high-risk screen when someone's coming into shelter. And then moving forward.
Kelly, can I just make note of 2 things? Sorry. In regard to lethality assessment, there's 2 things to make note of in Connecticut. One is that every single law enforcement agency in the state of Connecticut is utilizing the lethality assessment program. So that's a statewide initiative. I think we're the only state in the country to be doing that right now. But that has lent itself to other opportunities, in particular around housing. I think, Debbie, you wanted us to make note of the fact, though, that Dr. Jacqueline Campbell, who is one of the key developers of the lethality assessment tool, has not necessarily approved or I guess approved is the right word, for use in the housing area. Is that correct? Debbie, are you on the line?
Yeah, that's correct, and the guidance we're giving now that it's a lethality assessment, and it's based around lethality. It's not a screening tool for housing, so it's definitely not a standalone tool that one would use to screen people in for housing, and we definitely do not want it to be used for screening out of housing if someone is in a very volatile, high danger situation, or screening in or screening out if it's too low. So there's some caveats around there, and it's definitely not a standalone housing screening tool. So thank you.
And so, and we're not saying that we're not taking the LAP tool and say this is our housing screening tool. We're just offering it as one additional layer of risk assessment to add into the equation of the information that we're capturing for the domestic violence survivor. Thank you, Kel. Do you want me to move to the next slide?
I think that it would be helpful if we look at the next slide. So this is actually the referral form that we developed, CCEH and CCADV developed together, and this goes hand in hand what we were speaking to on the previous slide. So initially, the program does the VI SPDAT in-house. They fill this out. It's a fillable PDF form, and they email it to me. I am the point of contact at CCADV that does the initial the second layer of de-identifying. So if we look at number one, the referral date, so when was the information sent to CCADV? Again, we spoke towards what can the client is seeking placement to. The VI SPDAT score, the household type, are they chronically homeless? So it's just a yes or no. High risk priority, so back to what Karen was saying is that we're not using that information to say that someone should get housing. We're just using it to determine if they're a high risk priority. Below that is what I would fill out. So I fill out my name, my email address, my phone number, and then from there I develop a unique client ID. And we just like to let our individuals know, our staff know, that we do not have access to any of the information on somebody's housing. Can you go to the next slide?
Sure.
I'm sorry, I don't have control.
Yeah, that's okay. So, but just so that people understand, so what CCADV does not have access as a second layer of de-identification. We do not have access to around any specifics outside of this basic non-identifying information.
So from there, Brian and I share a Google document. It's a secured Google document, and we have this information on the Google document to keep track of what we're doing. Obviously, this is just an example. We're not using the real IDs of any individuals, but so I would enter the client unique ID into this Google document, the submission date that I gave it to Brian at CCEH. I'd leave the CCEH acceptance date blank because that's for Brian to show me that he's accepted it and entered it into HMIS. What coordinated access network or can the individual is looking for placement in, and then the score, the housing type, and if they're high risk as well is put in as the notes. But also what I'd like to add is once that referral form is complete, the referral is forwarded to Brian, and it's also sent back to the program that sent it over and initially did the VI SPDAT. Brian, do you want to add anything?
A lot of what that Google document's for is to keep me honest, or CCH honest as the case might be, for making sure that once the referrals come over, they get into our system in a timely manner, because getting someone access to housing can sometimes take a while, and we don't want them to linger in a pile of paperwork on my desk. And so far, the system's been pretty responsive. We usually get the information from CCADV and then get it into HMIS. So generally within a business day, I don't think there's been a whole lot of instances where that has gone beyond that time frame. But I did just want to back up real quick to our form here. And I know Karen had talked about this earlier, but this was a couple of years worth of conversations leading up to the information that we collect and that we put into our system. This isn't just kind of like what we dreamt up the first time, because what we dreamt up the first time got shot down 6 different ways. I know she talked about like the household type and number of rooms and not identifying how many people were actually in the family. And we certainly don't get all of the information that goes along with the VI SPDAT because of the amount of identifying information that goes into there. Because those of you who are familiar with that tool, just getting a number tells you absolutely nothing. If you get a score that's a 1, that could be somebody who has a substance abuse issue. It could be somebody who's over the age of 65. It could be somebody who has a long-term physical. You really have no idea what the score is in relation to any kind of personally identifying information. And this had gone back and forth between us and then all the national partners Karen had talked about before, the Confidentiality Institute. So there is a number of different checks and balances that went into creating this form to begin with. And again, I do just want to echo that absolutely no victim service providers are touching HMIS. CCADV isn't even touching HMIS. It goes de-identified from the service provider to CCADV, who further de-identifies it, who gives it to me, who gets it into the system to begin with. So there's a couple different layers, and by the time it gets to me, I have absolutely no idea what's going on, and I couldn't de-identify it if I wanted to. Kelly or Karen, did you want to add anything, or do you want me to talk about the outcome screen here?
I just wanted to add one thing before you get to the outcome screen. So, and that is that while we checked in with many national TA providers to get their feedback, it's not that they were necessarily endorsing what we're doing. So I just want to be clear on that. It wasn't that we weren't necessarily seeking an endorsement. We wanted to do our due diligence and understand, make sure that we were following federal guidelines, and also make sure that we were offering confidentiality to domestic violence survivors. So they're not necessarily endorsing it, and I can't even say that everyone loved it. But given that we're trying to navigate some waters that weren't being navigated previously with any guidance from the top, we just felt that we needed to try to test this out and move forward in some way. So I just wanted to make note of that. And Debbie, I don't know if you want to add on as well, or if that kind of captures that piece.
No, that captures that. Thank you very much.
So Brian, do you want to speak?
Sure. This can get a little wonky, so bear with me here. So this was from last year, the number of referrals that came into our system. We had a total of 23 individuals and 36 families throughout the course of the calendar year to be referred in. Now that could have happened on December 31st of the year. So it's just what the system looks like in a snapshot. So at the end of the year, we had 12 individuals that were active in our system, which means they're currently on a by name list awaiting housing. And 11 of those, 11 of the 23 had been moved to inactive. 6 of them being housed. We weren't able to contact 3 of them, and 2 of them are in an institution. Generally, that means someone was incarcerated or they're in like a long-term medical care facility. For families, 36 total in, 24 are still active, with 6 currently being matched to a housing program, which means they have their essentially certificate in hand, just waiting to find a place. 1 is currently enrolled in a transitional housing program, and 17 are in process in their coordinated access network. 10 of those were housed, and we weren't able to contact 2 of them. Now, go ahead.
So I thought we had done some comparison data to understand how well or not we were doing around housing domestic violence survivors compared to individuals who are housing insecure, not impacted by domestic violence, and that it looked as if, and please correct me if I'm wrong, but I thought that the data that we were viewing over the previous year was that domestic violence survivors were actually being housed at a rate that is higher than your system. Is that correct?
That was just what I was going to say, Karen. So
thanks.
Thank you for getting that out there for me. And I think a lot of that has to do with the ability of the domestic violence providers to advocate for their clients at the housing matching meetings, and the fact that we are prioritizing the domestic violence survivors in the housing matching meetings who have the lethality screening of being high. So there's a lot of different things to take into account here, but in general, the referrals that come from CCADV are housed generally faster and at a better rate than most of the folks who are currently in just mainstream services on our by name list.
I'm seeing a question from Eve Sheedy that asks, when you find housing, how do you contact them, or who does the contacting? Can you or Kelly answer that question?
Sure. So
that usually does not. Go ahead, Brian.
Oh, go ahead, Kelly. No, Kelly, you can take this one. I'll leave it to you.
Okay. So that usually, in most cases, if they reach out to Brian, Brian usually refers them back to me. And what happens is that I will get the individual's information that's looking from the CAN for whoever the advocate is. And what I will do is, being that it's coded by, each program's coded with a different number, I know which program to call. I may not know exactly what advocate it came from. I'll call the program, and they will connect through there. So I'm still not providing the CAN with what program the individual is in. I'm actually giving our advocates the chance to do the outreach, because they also have to do the back leg work on if the person has maybe been housed elsewhere, possibly moved, maybe moved out of state, so that they can prepare for the conversation at hand. I don't know if you want to add anything to that, Brian.
No, it's not the most direct line of connections, of course, by design. So when someone is identified as like essentially being next on the list, the Coordinated Access Network will outreach to me or to Kelly, but I don't have any information on them, so I do just send them right back to CCADV, who has that next level of information, so they're able to reach out to the individual projects to make sure that the advocates know that CCADV 123 and HMIS, whomever that may be on the other end, is able to connect them with the mainstream housing service.
So Elizabeth had a question around issues or challenges, so which brings us to our final slide, and then we're happy to answer any questions. Debbie, I'll kind of kick it back to you to understand, and I know there's someone from HUD who's going to answer questions as well, but so we really thought about, for this last slide, what could we share at this point, knowing again that we're still on this path to figuring all of this out, like many of you in your states are as well. And so it's a continuous work in progress, and we really have had to force ourselves in a very positive way to reconnect, so the leadership reconnects quarterly to assess how things are going on. There are things that come up that we have to work together on to navigate through, and a lot of that speaks to the cans and how things are going. And as you can imagine, there's lots of assumption on both sides in terms of how the other system works, and there's always a little bit of a rub. I think it's getting a lot better, at least on our end, and Brian, you can speak to your end, but you know, there are only so many resources to go around, and when that happens, it can often be a little bit of a rub around how to, you know, everyone's fighting for those same resources as we all do as advocates, but both myself and Lisa Tepper Bates decided many years ago it doesn't work well to be fighting over the same resources. How do we work together to figure out how do we best capture what we have to house individuals, whether they're domestic violence survivors or individuals who are housing insecure. And then our systems are different. They just are. So domestic violence shelters are not homeless shelters. And so sometimes it's just, you know, there are we know that there are reasons why a domestic violence survivor is temporarily residing in a domestic violence shelter that are different from being housing insecure. And so there's been a lot of conversation and training and communication that has been necessary so that we can help our two systems get a better appreciation for where we're coming from, especially around trauma, understanding that trauma looks different within our systems, and how do we recognize that and work with individuals based upon that. So and I can't say that we're fully there yet. I think it's always going to be there. I actually participate in a lot of the statewide housing initiatives around, they call it Reaching Home in Connecticut. The state's planned around ending homelessness we're involved in. So it has also required that our state coalition be at the table and involved in those conversations when plans are being made, when policies are being developed, when benchmarks are being created, and always very cognizant of how that impacts our system and survivors, and to work together to come to a place. And again, we've had some really spirited discussions over time, and I think there's just there's such a better understanding and appreciation from where we're each coming from, what the work is that we are doing, and I think it's a lot better within coordinated access networks regionally. And as you can imagine, when advocates, housing and domestic violence advocates are working together in this way, there's all sorts of other very positive outcomes that then emulate from that relationship building that is very impactful and doing and helpful also to the individuals whom we're serving. And so one other piece is that there is a Be Homeful project that was established by the Connecticut Coalition to End Homelessness, and that has to do with, and Brian, you can help me with this, but my understanding is the discretionary, diversionary funds to help keep people from becoming homeless. How do we offer that car payment, that first month's rent, and other things to take care of a barrier before it becomes a crisis? And so we know that there are many domestic violence providers who are also reaching out to CCH to acquire some of those REP funds for their clients. And so we're working collectively with CCH to raise money into the Be Homeful Project Fund because we know that it benefits both of our constituencies, and so that's been very important for us. And I think I already spoke to the necessity of a trauma-informed approach, but that's something we work really hard around with advocates and both domestic violence advocates and housing advocates around training and cross-training. So Kelly and Brian, I don't know if you have any additional pieces to add. And then Debbie, I'm looking on here, so it looks like do people, if you could just answer Debbie, do people press *6 if they have a question to unmute, or how does that work?
So how we're going to do the Q&A portion of the webinar is we'll ask people to please put their questions in the chat box, and then I'll just repeat the question back to you, and we can go in that direction. But I have seen quite a bit of talk about landlord engagement and landlord resources, and that's something that people are very interested in. And is there more information you could share in Connecticut of how you've engaged landlord, and if you have a statewide strategy or if it's up to the different regions? So anything you can add about that would be helpful.
Well, I think that's a great question, and so the best way that I can answer it is to say that, and I'm sure folks on the phone can appreciate this or participating in the webinar, is that advocates are advocates, and so they know how to advocate for a domestic violence survivor in multiple ways, and part of that is the relationships that you build out in your community. And, you know, in Hartford, Connecticut, which is actually our largest domestic violence program, their advocates have incredible relationships with landlords. They will go to meetings, they will negotiate, they will try to approach things 10 ways to Sunday to help a survivor access housing. And so the best way to answer that is we don't do necessarily a training around landlords, but what we do is our standards and our training around advocacy speak to how we work within our communities to have collaborations and relationships that are meaningful so that it is in the best interest of survivors.
All right, I just want to check and make sure we have Fran Ledger on the line from HUD as well, and I just want to make sure, Fran, can you join us? And I just want to make sure we can hear you on the line.
Yes, can you hear me?
We can hear you. Excellent. Technology's working. Okay. So I think there's a question on the VI SPDAT. Is that the one that we think would be a good question for you? Yes, on weighing of the VI SPDAT and how it works with the coordinated entry system. If you could talk about that, I think that would be, and talk about how you enter the information and if you need an HMIS license. Yes. Okay. That's a very convoluted way of asking a question about HMIS and coordinated entry. That's in the chat box.
Okay, just so I'm clear, is this question for me to answer around the VI SPDAT? I'm sorry, I'm not hearing a response.
Can you hear me? I think
Yeah,
something
I
just
can hear you.
happened. Yeah.
Yeah, I think we may have lost our facilitator. So I will go ahead and I will answer the VI SPEDAT question with
Okay, great.
a little bit of background first. So as part of our coordinated entry requirements, we have to use a common assessment tool. There is no mandated common assessment tool as to which one you use. In Connecticut, we happen to pick the VI SPEDAT. So that's why we're talking so much about it, because it is the tool that we use. I'm sure there are other ones out there that are used by other COCs, but the one that we happen to use in Connecticut is that one. And how did we learn how to administer it? One, we had the folks from Org Code come down to Connecticut and conduct some trainings on how to administer the tool, because the fidelity of conducting the instrument is important. Because in theory, you should have 100 different people administer the tool and you would get the same answers and the same score. So that was important to us. And then after a long time of a lot of folks using it, we had them come back and do a train-the-trainer session so we can bring that in-house. And now the Connecticut Coalition to End Homelessness provides those trainings on administering the VI SPEDAT in Connecticut. And just to answer another question I saw in the chat box was, who is the COC in Connecticut? Is it CCEH, the Connecticut Coalition and Homelessness? No, we are not the COC lead. We are an advocacy organization or a member organization, and we happen to be the HMIS lead in the state. The COC is co-chaired by our Department of Housing and another group, AIDS Connecticut. And our Opening Doors of Fairfield County, they're a separate COC. They have a separate set of co-chairs down there. We are the HMIS lead for both of those COCs. And have we gotten our facilitator back?
Yes, I'm back. Thank you, guys.
Okay.
Yes,
welcome
sorry.
back. We were pinching
We had
while
our
you were
first
gone.
technical glitch. Yes, I'm here. Yes. It sounds like you guys are really great about continuing answering questions in the chat box. And it looks like, I don't know if we got to the question about how the VI SPEDAT is weighted in determining who is next for in line for housing. So anything around prioritization and how you're working on prioritization in Connecticut.
So we are working on our prioritization guidelines now through kind of like a dynamic prioritization-like process, where it's not just a VI SPEDAT score that's going to put you at the top of the list, but it's a variety of things, a lot of those being what you would expect with length of time homeless and severity of disability and things of that nature. And we're working off of kind of like a looser set of guidelines right now, but we are working as a state to institutionalize exactly what that looks like.
The added piece with the information that is being offered to house domestic violence survivors is that what is different is the risk assessment piece that's added in to all of that and a part of the overall picture. But again, I think what also this lends itself back to is the conversation and the work that's happening in communities within coordinated access networks around the discussion around housing, availability, priorities, needs, and it's that collaboration that is yielding results for individuals in our state. So I just don't want to give the impression that this is,
I'm sorry.
You know, it's not just, it's about the scores, and it's also about the feedback, but it's also about the conversation, I think, that's happening within coordinated access teams around how best to house people and prioritize that.
Yeah, and Karen, can I just add an extra layer onto that?
Sure.
Is that the VI SPEDAT score also determines, and it's not, you know, this is the only thing that you can have, but there is flexibility, but it also determines if someone's available, if they qualify for rapid rehousing dollars, supportive housing dollars. So it kind of falls into a category, and then that next step is done at the CAN meeting where our advocates advocate for, no, you know what, our client, I know that they fell into the the scale of getting into rapid rehousing dollars, but they probably would fit better into a supportive housing program. So that's another way at first, and I'm not sure, Brian, if you guys are working on changing that, but that's one of the things that the score also determines.
So it doesn't determine it. It puts them into a recommended range, right?
Yes.
Because
it's
the reality of that situation is if I was to have a VI-SPDAC conducted on me right now, I could score a 0 or I could score the highest range possible because I know how to answer those questions. So we don't take that as gold every single time. I mean, it's a great tool when conducted properly, but we use that in conjunction with a lot of the other data, specifically on length of time homeless, because we have a statewide system that goes back 7 years, so we could see how long someone has been, at least in the mainstream system in Connecticut. So it's a piece of that puzzle, but it certainly isn't the entire puzzle.
And I'm looking at a question from Emmy Ritter, and the question is, has there been any conversation about providing additional housing resources to the DV system in order for survivors to be served there instead of the homeless system? And that's such a great question, and I get asked that by the heads of the localized domestic violence programs all the time, because this hasn't been easy. There's a lot of moving parts to this. It's complicated. It requires a lot of work on both of our sides, but the place that we continuously come to is, yeah, could I and our advocacy system work to get a cutout of funds through DOH or through some other resource to be able to offer housing to domestic violence survivors? Yes, we could do that. We could work within our separate silos. Or what we can decide to do is, well, it's more difficult and complicated, and there's lots of things to figure out. Is it in both of our best, the interest of both of our constituencies to work together? And so we sometimes, when it's become really hard, Emmy, I've said to myself, and I've been asked, geez, is this all worth it? Couldn't we just try to get some money for domestic violence survivors? And yeah, we could try that, but what we have decided is that it makes the most sense for us here in Connecticut to try to work together. We've become a very powerful voice within the legislature around housing, because we're not up there saying, give us this piece of the pie and give them that piece of the pie. We're talking collectively about why the full piece of the pie matters to the people whom we're serving. So that's just what we've decided. What I will say, though, as a caveat is, for years, the Department of Social Services has provided some funding for transitional housing, and that has been utilized for DV programs, very specific to DV programs. So there still is that revenue stream. It has experienced some reductions along with a lot of other things in the state of Connecticut over time, but that still does exist. And then two of the 5 domestic violence organizations in Connecticut who are offering longer-term housing to domestic violence survivors, 2 of them receive funding from HUD for permanent supportive housing. So there is that little bit of a carve-out, too. So that's been, not to get too complicated with all of this, but that's been tricky for us, too, because we are not HUD funded. So in general, the domestic violence system is not funded by HUD. We have these 2 providers who get a very small amount for some permanent supportive housing. But outside of that, we are not regulated by them, but yet within our conversation with our balance of state entity and also Reaching Home Connecticut, we have forced ourselves to be engaged in the conversation, because at the end of the day, housing resources and access to housing matters to all of our survivors.
And if I could chime in really quick, Karen, that's a great question, Emmy, and just to highlight an overview, this is what's working for Connecticut, as Karen's described, and it's working really well for their state, but this is part of a webinar series, and there will be a bunch of different communities highlighted, and we will be highlighting your county, Multnomah County, in the future, in the next couple months, and they will be discussing their comprehensive housing, DV housing system that is COC funded and their coordinated entry process. So all of you on the line will get a different approach to how housing is accessed by survivors, and we'll have that webinar as part of our series. And then I also wanted to have Emily Reamer from Collaborative Solutions chime in with a Q&A question as well.
Yes, hi everyone. I apologize if this was answered while we were having some technological challenges, but I wanted to make sure, because I know it's been a real challenge in the field, around conflicting information about can you enter information into HMIS anonymously, and that folks in the field are getting different answers to that. And so I'd like to ask Fran to speak to that, and a reminder that Fran is from HUD.
Thanks. So this is actually fairly complex, and we have different rules out there. There are some that are in effect and some that are not, that they're proposed. And so I think that creates some of the confusion that communities experience. So trying to ferret through all those to figure out which ones are applying to them. And also I say that there are multiple software vendors, multiple products out there, and they do different things, and they use different language to describe stuff. So one vendor might describe anonymous in one way, and someone might describe it in another way. But as far as HUD is concerned, we are looking at what's called personally protected information, and that is a set of data elements that essentially the spirit of it is that this particular data should not allow you to identify who the individual is. So it can be something very clear like name and date of birth, but it could be a combination of some things that if you just had one of them, you would think, well, I wouldn't be able to figure out who that is. But in combination, you would be able to figure out who it is. So there's some complexity to say that you're putting anonymous data in that may not necessarily be true. But if you could guarantee the person could not be identified from any information that you're putting in the system, then that more fits with the spirit of personally protected information. So from the HUD's perspective, if you're a victim service provider, and there's a definition for that under the HEART Act, you cannot put any information that is personally protected information into HMIS. You must use a comparable database. And in that comparable database, you would put the full range of information about that client, but you could not do it in a HMIS. The part where there gets to be some confusion is the HMIS proposed rule came out, and in the proposed rule, which this was the direction HUD was heading at the time that it was developed, you would not put any information, identifiable, not identifiable. No, victim service provider would not use HMIS. And in the spirit of things, you would not want to create a workaround where somebody else put that same information into the HMIS on the victim service provider's behalf. So those are, I don't know if that quite gets to the question that I saw earlier, but please clarify if there's something else I should add to that.
I don't think so. I think I think that covers it. Thank you so much, Fran. We do have a few more questions trickling in. It looks like, Sylvia, there's a lot of requests for your screening or assessment tool. I'm not sure how you're naming it, but if you could please send that to me after the webinar, that would be great, and then I can send it out to everyone who's on the webinar today, so you don't have to email a bunch of people. If you're willing to share that, we would love to get that out to the field, and my email is dfox@nnedv.org. And then it looks like people want to know when the slides will be available. They will be available later this afternoon, and also on the Safe Housing Partnerships website. They'll be archived there, so you can go back at any time to take a look at them. And please pass along this resource and this information to your colleagues and coworkers. And if there's any last-minute questions, I'm I'm fine saving everyone 15 minutes in their day, but if there's any last-minute questions, the chat box is still open, and we do have Fran on the line from HUD, so if you have any of those last burning questions that you might have. And then I also want to do a quick plug as well. Fran did mention victim service providers using comparable databases and what that looks like. That's not something in Connecticut's wheelhouse because how they've set up their coordinated entry system with CCEH, but we are also doing some webinar series in the summer on how to select a database and what is a comparable database, because there's a lot of vendors out there, as Fran mentioned, and there's a lot of confusion in the field, as this is a very challenging part of the work that we're doing. So we're going to do a webinar series on how to select a database, what is a comparable database, what does that look like, and then also highlight some state coalitions that have done some excellent work around rolling out their comparable databases. And if you also are a part of the community that has a comparable database and it's working well and you're happy with what's going on, we're always happy to hear from best practices and innovative practices in the field and get that resource out to other folks. I don't see any other questions. So do you all presenters on the line have any closing thoughts or anything else you want to add before we wrap up our webinar, today's webinar?
I don't think so. I think we just appreciate being able to share and being asked to be able to share what we're doing here in the state of Connecticut. It is working well. We have the data to demonstrate that survivors their confidentiality and their personally protected information is occurring through this approach. And absent any consistent guidance, this is what we've developed and it's working well, and we're pleased to talk about it. And if people have questions and like to contact us, we're happy to do that also.
Yeah, at the end of this presentation is our contact information, well, at least Karen's and my contact information. Reach out anytime. We're generally pretty responsive and happy to help where we can.
And we have one last question I think that we should clarify on how their coordinated entry lead enters client information into HMAS by using an alternate ID, and they want to know how that will affect their system performance measure in their APRs. Fran, do you have a second you could jump in on that one?
Well, if it's, yeah, let me just read through this real quickly. Yes, okay, so the coordinated entry lead agency is entering DV clients into HMIS using the alternative ID. One of the problems with using an alternate ID is that unless you kept records outside of the system, to then know whether you have two folks in your system that are actually the same person, then it's hard to get at aggregate data because you could have that person in your data set twice. So now you would, when thinking about creating some kind of a unique ID, somewhere it needs to pull to the same person so you know you're counting one person and not two people. The only time that you would be entering in DV client information into an HMIS is A, the agency that's entering it is not a victim service provider, and again, you cannot enter it on behalf of the victim service provider. And the agency is not receiving any VOW or FRIPSA money. So if it's, for instance, if it's a mission and somebody comes into the mission and they identify themselves as being a victim of violence, you would want to, A, have some protocols in place so your mission or the other providers that are within your coordinated entry system understand how to serve that client in order to keep them safe. But when they go to enter information into HMIS, you'll want to think about things that you can do to help protect their information even when it's in the HMIS. So the information can only go in there if it's a non-victim service provider agency. They're not receiving any VOW or FIPSA money. And then when you do it, you want to be careful how you do it. You want to always be thinking about the safety of the client. And the more technical pieces, using an alternate ID or using an anonymous feature that a vendor might have that actually may impact your system performance measures or your APR because you may not be able to de-identify that client and get to a unique count.
Fran, this is Karen. Is there any sense when HUD speaks about a comparable database when HUD will come out with some guidance around what they would view as a comparable database?
Yeah, we're coming out with some guidance about that, and we're also coming out with some guidance for continuums of care to help them clearly identify whether a project goes into a comparable database or an HMIS, because sometimes it can be really confusing if it's like, let's say, Catholic Charities, and domestic violence is not their primary mission, but they may have a project within their overall agency that strictly serves victims of violence. So then what happens to that information? So it'll be a decision tree that's going to get released that helps folks to kind of walk through all the questions that need to be asked to determine if a project can go in HMIS or not for those agencies that are not a victim service provider agency as defined by the HARS Act.
But when do you think, when you say soon, is soon a year from now, 6 months from now?
I would not say a year. It'll be faster than a year. We're getting close. I would love to be able to give something more concrete than that, but I'm not able to.
Okay, think we're good and ready to wrap up the call a few minutes early here, and we'll be looking forward to seeing that resource on comparable databases in the future. Fran, so thank you. So that brings us to the end of the webinar, and I want to thank you all for your patience. We only had one technical glitch today, so that's a success. So on behalf of the National Network to End Domestic Violence and the Deviant Housing Technical Assistance Consortium partners at Collaborative Solutions, the National Alliance for Safe Housing, and the National Resource Center on Domestic Violence, I'd like to thank Karen Jarma, Kelly Anelli, and Brian Rockapori, and Fran Ledger from HUD for taking their time to share their innovative and survivor-centered coordinated entry processes with us today. And I'd also like to thank you all for all of you who participated on this webinar. So we will be sending out the PowerPoints from today's webinar as well as a recording for you to reference and to share with your colleagues. And we also will have an evaluation link to that email as well. So please fill out that evaluation. That's great feedback for us as we're doing our work here. And that will be sent out later today. And you can also find the webinar on the Safe Housing Partnerships website at safehousingpartnerships.org, where you will find additional resources on the intersection of DV and housing and homelessness. And you can also request technical assistance there on the website as well. So thank you all again for participating, and thank you, and have a great day.
Thank you.